Hi guys, this is Megan Mosier at Lincoln Community Hospital, Lincoln Health. I'm here with some professionals today talking to you about what you can do to stay sane during the stay-at-home mandate. Jo Beth is going to go over some stuff to let you know what the stay-at-home mandate means, first of all. But sorry we're a few minutes late. If you know me, you know that's how I roll. So we'll get started here.
So I'm sure a lot of you have seen a lot of the things that the media's put out. The biggest thing is, I mean, you can stay home, but you can still go for walks. It's really encouraged that you do get out just for your mental health. You can get out, you can go for walks. I think you can even go and play golf. It's just a matter of having that social distancing from other families. They really want you to stay within your family, not necessarily go to other places, no play dates. The playgrounds have obviously been closed. So it's just one of those things that for your mental health, it's important to get out. So even if it's playing out in your backyard, I've seen families playing out in the street, but not necessarily with other families. I mean, it's still really important for you to get out so you don't get that cabin fever, because it can really affect you.
And Jo Beth, the fishing ponds are open still, right?
Yeah.
Yep. So there's outdoor spaces in our county that you can visit.
Yeah. And the shelter in place, I mean, that means shelter in place. So it's really encouraged that you don't go out of county unless you absolutely have to. So please stay home in your residence. Don't go out and visit people if you can absolutely help it. Just because of different exposures. Even though everyone in the state is shelter in place, it's not to say that you can't go to another place and essentially get it. So please stay in our county if we can help it for the time being.
Perfect. And I'm sorry, I skipped introductions. Tanya, why don't you go ahead and introduce yourself?
So my name is Tanya Lumley. I work here at Lincoln Community Hospital. I'm a social worker here. Basically, I do referrals to different agencies throughout the county for individuals who are having issues. If you find yourself at home and you're frustrated and you think that things are going to get out of control and there might be some domestic violence or child abuse, please reach out to the services that are available to you. We have behavioral health here at the hospital in Lincoln County. We have 3 behavioral health therapists here on staff. We also have Peak Vista in Lyman, and we also have Centennial Mental Health in Lyman. Those individuals are ready and willing to help anybody when they need it, day or night. So you can call those individuals at any time. We can post those numbers on Facebook, and I will have Megan do that so that you have all of those contact numbers.
Perfect. Thank you.
Another outlet that you can do is the Call Crisis Service. It's a 24-hour hotline. And we'll post the number. You can also text the number. So if you just find yourself that for whatever reason you can't get a hold of someone, it's like 1 o'clock in the morning and you need to talk because you just can't take it, these people will also help you through and try and talk you through what's going on. And the biggest thing is I mean, we just want to make sure everyone is getting the help that they need. So we don't have future problems. I know this is a hard time, especially when parents are home, homeschooling, so everyone's just kind of on edge. So we're just trying to promote some healthy habits instead of leaning on to potential drugs or alcohol.
Perfect. Thank you. And that's the biggest thing that we wanted to focus on today is, regardless as if it's strife within the home, between family members, or hunger, loneliness, sadness, there are people who are sheltered in place alone. We want everyone to understand that there are resources. Jo Beth has been hosting a call, and for those of you that don't know, Jo Beth is our Lincoln County Public Health Director. She's been hosting a county-wide call with all of the directors of every entity that has anything to do really with this outbreak in our county. So those calls are weekly, and so there's a lot of resources out there that I think I was surprised this Tuesday to find out about. So we'll get a list posted so that people know there's no reason for you to go hungry. If your kids are not of school age, there are still meals being provided by Lyman School District. There's information, there's resources, there are people wanting to help. So just because the mandate says stay home.
Yeah, you can still go out, it's just limited. Food banks are open, it's just limited. We're posting on our public health page resources for that. So if you need that, DHS has some resources for unemployment and food assistance. So if you have any questions, WIC, we're still seeing some WIC clients. So if you need help with that. So there are options, and if you have any questions or concerns, I mean, on what kind of resources, you can contact Tanya or myself, and we can try and get you to where you need to be. So some of this isn't so hard and trying. This is just, it's different, and right now this is kind of our new normal, unfortunately, for a little bit.
Right, and maybe we talk about the telehealth services. So if people aren't comfortable leaving their home, or if they're high risk.
Are you guys doing?
Well, Lincoln Health, we are able to do telehealth services. At this time, I don't even believe we're seeking referrals on that right now. So that you can call the hospital and make an appointment either in the clinic, or we can schedule a telephone call, and very shortly we can schedule kind of a FaceTime phone call where you would be able to see the counselor and they can see you. And that is really up to you, on your choice of what you prefer. The first half of each day in our clinics is dedicated to well patient visits. So that's when those therapy sessions are happening. That's when patients who don't have other illness or other symptoms are being seen, and then the clinics are thoroughly cleaned before seeing walk-in or ill patients.
Sure, and then if you have issues in the home with elderly populations that can't get out to get food, just give somebody a call. We can try to make sure that something is delivered to you, either through the grocery store or through the food banks, DHS. Here in Lincoln Health, we have people who run errands for people all the time, so we can connect with that. All you need to do is call and talk to me here at the hospital, and I can hook you up with those resources.
That's awesome. Yeah, I know there was concern that the Outback Express wasn't running any longer, and those calls are still being accepted by Lyman Town Hall, and they are still making sure that deliveries are being made and that people are getting the resources that they need. So don't think that because of this shutdown that you are just stuck in place without the things that you need. We do have a question from Angela. She said, do you know if Hugo is doing any activities such as the bear hunt or anything for families with children while they are out for walks and such? I'd love to share them if there are any here. Angela, thanks for the question. I haven't heard of anything yet, but as soon as I do, I'll be sure to share it on both the hospital page as well as Lincoln County events. So I'll keep people posted on that.
There are some churches that are looking to do an Easter service, kind of where they drive-in. I know in Hugo, Lyman Methodist is planning one at the fairgrounds. There's another church they're trying to figure out logistics on that. So, I mean, for Easter they are trying to make services available. It's just you drive in and you would hear the service. Everyone stays in their car, so it would be something just to have.
Yeah, and that Easter service at the fairgrounds is at 9 a.m. on April 12th. That's the Easter Sunday here in Hugo. Do you have any other questions? We knew this would kind of be a short Facebook Live. We just wanted people to feel like the questions are important. There are people that wanting to help. It's obviously part of this staying at home order is a feeling of isolation. The sense of community is still there. Your community is still does still care for you, does still want to help. And there are several agencies that are looking out for people that need it.
And like I said earlier, if you have any questions on anything, feel free to contact myself or Tanya. We can try and help any way we can.
Do you have anything else? Okay. We'll get those resources posted, and if there are any follow-up questions, feel free to post them either here on the Lincoln County Public Health page, and we will be sure to get those answered. Thank you, everybody.
Thank you.